Welcome to Monday Redzeni with Well Life Hub Incorporated. Today I'm going to be talking about a topic that is very close to my heart and is using social media in reaching the vulnerable community with mental health services and information. I think this platform, and as from its inception, the inception was because I was missing the classroom and I thought of the channel as something to reach people with the information and also just to spread widely the services that we provide. Here at Well Life Inc., we provide free monthly support groups. And since the pandemic of the COVID-19, we have been doing it online. We tried hybrid after the pandemic, but it just turned out that it worked out much better online because we're even able to include people that are outside the borders of our vicinity, so people from other provinces, even people from other countries. And the reason I want to talk about this is just to say to people who've got voices to be able to reach out to marginalized communities, to impoverished communities, to communities without the resources, both the infrastructural resources and also the access. And what do I mean by that? In many countries, including ours, mental health is not something that is taken as a very important aspect of the healthcare system. Although we know that it exists and it is part of our health, it does not form mainly what the governments will spend budget on or something that they will look at because it's seen as something that is not physical or that you cannot see. But contrary to the belief, and I think there was an episode that I did on the evidence of the impact of mental health. And so, as I'm saying, it will not be something that if you have a primary health clinic in a particular community where there will be a social worker, a psychologist, a counselor existing in there, but there will be a pharmacist, a nurse, a doctor, which then goes to show that there is not a lot of priority that is given on mental health. And platforms like ours, who provide psychosocial information or psychoeducation information, are very important, and we should see it as a very key. And as I said, what am I talking about when I'm talking about vulnerable communities? I'm talking about communities which are not in reach, communities where there's still a lot of stigma as well. So they can still be accessed and reached, but there is a lot of stigma surrounding mental health and what it means for somebody to be ill, what it means for somebody to be healthy. We can be using context and cultural sensitive information to be able to connect and to be able to reach, because again, and this is why we're doing it in this context. We're talking about examples and also things that people can relate to versus maybe people from other countries and continents or even other parts of the world. Influencers as well, endorsing and talking about their own journeys. And I think, when I look at books such as the one that Shudufadzo wrote, the previous Miss South Africa, where she was speaking about her own journey, and it resonates with people once influencers and people who are in the limelight speak about their own journey in terms of their own mental health. So it makes it to be relatable. And I'm not saying that anyone is immune to being affected or being affected, but it's just that when people see that people that they look up to, that they seem and think that they have perfect lives or they have it all together, when they talk about their own journeys, it makes it to be much more comfortable for them. It makes it to be much more relatable to say, oh, if so-and-so has walked this journey, if so-and-so has felt like this, then it must be normal for me. So it normalizes their whole experience. And for teenagers, there's many programs that use apps where you interact with a counselor on the other side, or you chat, and your AI and your chatbot, I think, has got a lot of contribution to make even in the future and already now, where a person can have their on call or on the tap right at the fingertips on what they are going through. Yes, most people will want the human touch, the human interaction, and that is why online services do not work as well as in-person services. But it's to say, where there is no service, a physical service like a clinic or a hospital or a center and a hub where young people can go to and meet, then we have those chat apps that young people can subscribe to. And I'm saying young because they are the ones who are more on their phones and they are more clued up. I mean, I was talking about something sometime a few weeks ago, and I was saying my BBT-ness is showing off because I was born before technology. So it will not be a go-to thing versus, people who are much younger than myself, maybe 20 or 30 years younger than myself, who will immediately or naturally then go to their apps. Something that is also very important that can be provided in the social media space is a sense of social support with anonymity. And I found it with our support groups, where somebody will more likely attend the online support groups other than in person, because there is that element of being anonymous, even when there is a label of the name, because they are sitting somewhere in France or in KwaZulu-Natal, in another province. They feel like they're anonymous and they're unknown, and they're more open to then asking those questions. And something that was very interesting for me was on a year-to-year basis, we do a topic of mental health and men in the April month. And we find that in many spaces, we hardly find men coming together whenever we say we are talking about men and mental health. But whenever we have these support groups that are geared specifically to men, we've got many more numbers than we will have when we are meeting face to face. Yes, I know that is a online service versus a social media service, but I'm talking about this interchangeably to say that the online space has got a lot to offer in supporting us on our mental health. And in summary, I think I'm saying influencers, people in spaces of providing knowledge, accurate knowledge, reputable knowledge, and also users. Whenever you feel you are at loggerheads, wherever you feel that there is nowhere else to reach, or you do not have cheap mode of accessing mental health, there are many platforms such as this one. Follow those platforms. Be in touch with the people who are providing the information to counsel you. There are many free services that are out there, and so that you don't feel like you're in the corner, you don't feel like there's nowhere to turn. And this can be something that is important in driving mental health access in the broader community, especially for vulnerable communities. With that, it's me, Nkateko Ndala, checking out. I will see you in the next episode.